So this is Tiffany, one of our staff members, and Ruger. Ruger has a sore knee that he's getting laser treatments on. So the first thing that Tiffany did was put his goggles on. They're protective eyewear. And Ruger wears them happily, as does most dogs. But if they don't, we usually just leave them off, but it's safer if they're on, so we like them on. Tiffany has her protective eyewear on as well. And she's going to start the process. So it's just a mild warming sensation that he's feeling right now. And it's not intrusive, it's not painful. Most dogs will hold still or at least tolerate us, and they definitely do feel better afterwards. We use it a lot for musculoskeletal problems. It helps reduce inflammation overall and pain. We also use it for skin issues, dermatitis, hot spots, things like that. And it's used for a wide variety of different problems. Ear problems, bladder issues, gingivitis or inflammation in the mouth too. So this is what's called a contact ball. The ball is touching his skin. And we also have a non-contact ball. If we can't touch the surface area, then we use a different head where we don't touch the tissue, but it still penetrates the tissues. And as you can see, Ruger quite enjoys this. And there's only a few minutes left on his time, if you can see that. 2.5 minutes left. And he's quite enjoying it. And he's definitely sporting some pretty neat goggles, huh? So the amount of sessions he had was initially we did one session every other day for the first 2 weeks. And after that, I believe we went down to about once a month. Is that right? Yeah. So he just kind of gets tune-ups, I guess you could say, to help further decrease the inflammation in his knee once a month. We've also done some acupuncture on him in the past, and he seems to respond a bit better to this because it's less invasive. He was good for the needles, but he definitely was more stressed with the needles in him. And every dog's different, but he really enjoys this, as you can see. You're a good boy, Ruger. So most of the sessions we do are pretty short and brief, and even if dogs initially are nervous, when they start to predict that these sessions helps them feel better, they're not invasive, they start to relax more too coming into the clinic, which is great for us to see. So Tiffany's moving it all around in sort of like a grid pattern to help make sure all the tissues are penetrated. And I believe he's all done. Good fella. Awesome job, Ruger. Are you a good boy? Yeah.